We have a lot of patients in which there is a particular set of signs and symptoms seen, and we can just evaluate through these signs and symptoms that the patient is suffering from a particular lobe abnormality, or a particular lobe is involved in the underlying pathophysiology. This syndrome, which is also known as the mesial temporal lobe epilepsy syndrome, in which the temporal lobe is involved and the medial side of the temporal lobe is particularly involved as an underlying focal pathology. So we must know how to diagnose these cases, or what are the particular treatment modalities that are available for treating these cases of the mesial temporal lobe epilepsies over here. So what can be the pathological findings in this particular case of the mesial temporal lobe epilepsy? It can be any sort of infectious states that are involved in that particular lobe, and that particular lobe is being affected. Either the ascending or the descending pathways to it are affected, or either it can be any sort of tumorous conditions or the paraneoplastic syndromes that are involving this particular lobe over here. So this can be the underlying pathology. Whatever the case is, the radio imaging techniques are going to help us a lot and diagnose these particular cases of the mesial temporal lobe epilepsy over here. History is very important over here, and you're going to focus on the particulars as well, the occupation, the environment that the patient is having, because sometimes the environmental factors can be acting as the triggering factors in the individual. So mentioning and highlighting those factors over here are very important. You're going to ask the patient for any history of febrile seizures, whatever the age is. Either it is the childhood or the infants or the neonates that we're dealing with, or even an adult. You're going to ask for any sort of febrile seizures that the patient has suffered from in the near future or even in the past. It can be a single isolated seizure. Whatever the case is, that is going to highlight the underlying infectious states that the patient is having. We can obviously resort to the lab investigations. You're going to run out. You're going to run the normal lab investigations as well. But before that, the detailed history taking or accounting the different signs and symptoms over here is very important. So the febrile seizures is one of the mainstay over here that you're going to focus on. Then obviously the family history, as we had already focused on the fact that the genetic considerations are going to be taken into account, and they play a very important role. So any history of any of the siblings also suffering from the seizure activity, either of the parents can be suffering from the seizure activity, they're going to be highlighted over here upon the history taking. Early onset or reappearing of the seizures is very important. So you're going to mention what was the age group when these particular set of signs and symptoms were seen in the individual, as we even saw in our case study that Sarah basically started having these seizures at the age of 7. So it was an early onset of the seizure activity, and that has to be noted down in the history as well. Reappearing of the seizures, how often these seizures reappeared in the patient, and what was the frequency of the seizures, how often the patient had been experiencing these seizures, and were they coupled up with some sort of a triggering activity or not. What was the onset, how was the onset of the seizures, and what was the duration of the seizures, the associated signs and symptoms, they're also going to be highlighted over here. So these are the peculiar points that you're going to look for in the history. It can be even a case of a rare generalized seizures, and so you're going to look for that as well. The clinical features particularly are a set of aura. It can be a sensation of smell. It can be the abnormal behaviors, the absent seizures. It's basically the staring or the glaring into space. Sometimes it is also coupled up with the loss of consciousness. So this is kind of the aura symptoms in which the patient knows that he or she might go into a seizure activity as well. So this can be This can be something that you're going to dig out on the history as well. Does the patient suffer from the aura, the state of aura or not? Or is the onset of the seizure activity quite sudden? You're going to look for that as well over here. The behavioral stress, is it the triggering factor for the development of this seizure activity or not? Complex automatisms are also taken into account over here. Then we have the unilateral posturing techniques over here as well. Sometimes they can be the precipitating factors in the individual, and sometimes they can be the relieving factors. So depending upon those facts, you're going to document that in your findings. Then we have the post-ictal disorientation. So after the seizure activity, you're going to see whether the patient is in a state of well orientation in time, space, and person. You can ask simple questions from the patient, and that is going to highlight whether he or she is well oriented in time, place, or person. So these are the simple questions that you can put forth to the patient. Memory loss, it can be the short-term memory, or it can be sometimes associated with a long-term memory loss that is seen in the patients. Dysphasia, that is basically an inability to phonate, is again one of the sign that is seen in the individual, and this is sometimes associated with these Mesial temporal lobe epilepsy syndromes. Then a lot of lab studies, for instance, the spikes on the EEGs are noted down. You also look for the hypometabolism on the interictal positron emission techniques that are seen, hypoperfusion on the interictal SPECT studies, and then we have a test in which basically you put on a lot of electrodes on the cranium, and then you look for the different activities of the different lobe areas. This is known as the VADAS test, and it's basically going to highlight what lobe is involved in the seizure activity. So these are some of the specialized lab techniques that you're going to resort to when you are basically diagnosing a patient with the mesial temporal lobe epilepsy syndrome. The MRI findings are going to highlight the fact that the temporal lobe is involved. Either there can be an increased activity seen, either there can be a tumorous condition that is involving the temporal lobe that is highlighted over here.